All right, good evening, everybody, and welcome to the fourth and final talk of the Lifestyle Habits for a Healthy Brain lecture series for Brain Awareness Week. My name is Anthony Robinson, and I am on the Society for Black Neuropsychology Education Committee. I will be the moderator for tonight's talk on physical exercise and brain health by Dr. Ivorie Walker. There will be a short Q&A session after tonight's talk, so please post any comments or questions you have for Dr. Walker in the comment section. Dr. Walker, thanks so much for joining us, and I'll turn it over to you now.
All right, thank you very much. So, Anthony, do you mind just, perfect, thank you. So I am Dr. Ivorie Walker. I am currently a neuropsychologist at Atrium Health in North Carolina. If you look at the map of my travels throughout my journey to be here, I started in Texas and I went to Baylor University for undergrad. And then I traveled on up to Philadelphia, where I went to Widener University for graduate school and specialized in neuropsychology, got that specialized training there. And then I went to the University of Virginia, where I did a lot of work with individuals with neurodegenerative diseases. And now I am at Atrium Health in North Carolina. So this has been a journey. I am very excited to talk about this topic today. I personally am a lifelong athlete. From as long as I can remember, I've been involved in some kind of activity, from ballet to tap, gymnastics, any sport I could get my hands and feet on as a kid, volleyball, track, and then throughout adulthood, I continue to train for obstacle course races like the Spartan race. So physical activity is very near and dear to my heart. I'm very passionate about this topic, and it's a privilege to be able to speak on this topic for you all today. So today we'll cover general benefits of exercise for overall health, benefits of exercise specifically on brain health, impacts of exercise in various neurological disorders, recommendations for types and frequency of exercise. And throughout all of this, I'll be weaving in information about factors that are specific to the Black community. Now, I realize that there may be a wide range of people watching this, either live or as a recording, ranging from professionals within the field of neuropsychology to people in the general community. So I'm going to cover a lot of good information while trying not to get too technical. So I just want to recap our journey thus far this week. And thank everyone for joining us for Brain Awareness Week 2024 on our journey. So we started off talking about stress and brain health. We discussed sleep. Yesterday, there was a talk about community and social support. And today I'll be covering physical activity. You could have put these talks in any order and they would have all made sense as far as the connections between all of them and the way that they all contribute to our physical health and our brain health. So you'll see as I discuss physical activity today, I will also discuss some of these other factors that are important for physical activity and that physical activity has good effects on. So first, let's discuss physical activity versus exercise. So you may see these terms used interchangeably, but there is a difference. So physical activity is described as any bodily movement produced by the contraction of skeletal muscles that results in a substantial increase in caloric requirements. And this can include activities like gardening, shopping, and housework. Whereas exercise is a type of physical activity consisting of planned, structured, and repetitive bodily movements done to improve and or maintain one or more components of physical fitness. So this is what we think of when we think of exercise. We think of sit-ups, push-ups, squats, weightlifting, running. So that is what comprises exercise. There are many, many, many different types of activities and exercise that you can do, anything from tennis, golf, bowling, swimming, hiking, gardening, climbing stairs, babysitting, if you've ever chased around small kids, and so many more types of activities. So physical activity has benefits across the lifespan. So for children, they can show better academic performance, better performance in school, better grades. They tend to have increased confidence in themselves, their bodies, and their abilities. They tend to have improved ability to regulate their emotions and to cope with stress. There is the reduced risk for depression, and there's also a decreased risk for chronic illnesses in adulthood, such as heart disease, diabetes, high blood pressure, and several forms of cancer. And across the lifespan, we see many, many, many benefits, probably way more than can even fit on this slide. So we can see improvements in the quality of sleep. And, as I recapped, we talked about sleep earlier this week and the benefits that sleep has for the brain. And so I do often recommend when people come in and they tell me that they're having trouble with their sleep, I say, well, let's add in some physical activity throughout the day. Let's do some exercise throughout the day to help regulate your sleep better. It also can help improve your appetite. It improves the clarity of your thinking. It improves your mood. It helps to maintain your strength, flexibility, and endurance. Helps to prevent 8 different types of cancers, and those cancers include bladder, breast, colon, endometrium, esophagus, kidney, stomach, and lung cancer. It decreases falls in older adults. It reduces the risk for postpartum depression in pregnant women. It decreases the risk for dementia, which I'll speak about in more detail in just a bit. And it decreases the risk for cardiovascular disease. So things like high blood pressure, cholesterol, heart disease, and type 2 diabetes. I do want to highlight some specific benefits of exercise in Black women. So one of those benefits is resiliency. So there was a 2021 study that found that Black women and girls responded in a positive manner when faced with discrimination. So they tended to show improvements in their physical exercise and healthy eating habits when they had higher levels of perceived racism. So when they perceived more racism, they tended to respond to that in beneficial ways. So in increasing the exercise and in improving eating habits. There are many short-term benefits to the brain related to exercise. And when I say short-term, I mean very acute. So immediately following exercise, lasting anywhere between a few hours until the next day. So we can see some improvement in the prefrontal cortex. So right here, this frontal part of your brain. And this results in improved attention and executive functioning. We can see enhanced positive mood states. So that feel-good state, that happiness, that tends to be enhanced. And then we can also see decreases in negative mood states, such as depression, anger, confusion, and tension. And then we can also see some improvements in learning and memory. There are other changes that happen in the brain that are longer lasting. So we can see that exercise does increase brainwave activity. That's important for decision making, creativity, focus, and forming memories. It helps with neurogenesis and neuroplasticity. So neuroplasticity is the brain's ability to reorganize itself by making new connections. So this is really important because part of the reason for cognitive decline is a decrease in those connections. So in essence, if we can create new connections, we can help slow or reverse some of those changes. And studies have seen that chronic exercise doubles the amount of new neurons that are generated and increases the survival of these cells. So these newly generated neurons have been shown to integrate into the hippocampus, so the structures here that are important for memory. And then we can also see that they're are increased hippocampal and medial temporal lobe volume. So again, right here in adults with higher fitness levels. One study found that exercise training increased the hippocampal volume by 2%, which is big. That essentially reverses age-related loss by 1 to 2 years. And the study found improved memory performance with increased hippocampal volume. So again, we improve the hippocampus, we hopefully improve the memory, since the hippocampus is an important structure in memory. Physical activity may also positively impact other brain structures. So the frontal lobes, the anterior cingulate gyrus, the inferior temporal lobe, and the parietal cortex. So basically many different areas of the brain. And then some studies have found a greater impact of walking on the brain in women than in men. And so this difference between women and men may be due to differences in baseline fitness. For example, one study noted that women were more obese at baseline before the study started and before they started the intervention of exercise, and they benefited more than men. So this may mean that women are more sensitive to those modest increases in low intensity walking because of some of those baseline differences. So exercise is also important for neurochemical enhancement. We can see that with increased exercise. I'm not going to go into the nitty gritty here, but I do want to highlight some key findings in that some of these factors showed a faster learning rate and more accuracy in learning. It resulted in that. And that results appear to be mediated by how habitual or regular the physical activity is. So the more regular exercise we get leads to greater improvements. Lactic acid, cortisol, and neurotrophic factors, those first three that I have listed here, are all important in memory. And so I'll talk a little bit about some of those. So with lactic acid, during aerobic exercise, glucose is broken down to pyruvate, which is then broken down to lactic acid or lactate. And lactate is able to cross the blood-brain barrier, and it can be used as an alternative energy source to glucose, and it plays an important role in memory processes and in neuroplasticity, which we just discussed. Recent studies have shown an approximate 20% increase in lactate in the cortex with exercise. Exercise also increases cortisol in the brain, which also crosses the blood-brain barrier and influences learning and memory. But important to keep in mind that cortisol levels above a certain point can actually impair memory. So it's important to consider that when thinking about exercise as a potential stressor that may actually negatively impact memory. And then we have various neurotransmitters that are shown to be increased in the brain with exercise. So dopamine, that feel-good neurotransmitter that's implicated in motivation and rewarding effects. We can see that that has a positive effect on cognition. Serotonin is implicated in mood. And so studies have found that chronic exercise is just as effective as antidepressant treatment for improving mood. And so this is huge because I get a lot of patients that come in and they ask me, even though I don't prescribe medication, they still ask me questions about it. And they say, well, I don't want to be on antidepressants my entire life. Is this my future? Will I have to be? And so we can keep this information in mind when we talk to our patients or anyone about this, is that exercise, again, has been shown to be just as effective as antidepressants. So if we can get someone on a regular exercise routine, we can see long-lasting effects on their mood. Acetylcholine is another neurotransmitter that has been shown to increase in the brain with exercise, and acetylcholine is very important for plasticity and memory formation. And then we have endogenous opioids and endocannabinoids, which increase after acute exercise. And so there is a theory that that runner's high that people experience when they've been doing a lot of really intense exercise, and then you just feel like you can do anything and keep running. that is thought to be due to an increase in the endogenous opioids and the endocannabinoids. So now I'll cover some typical disorders. I'm not going to cover everything, but just some disorders that we have some research on to show that exercise can be beneficial for. So exercise increases the release of dopamine and norepinephrine, and those neurotransmitters have lower activity in the brain in individuals with ADHD or attention deficit hyperactivity disorder. And studies have shown that exercise works similarly to the stimulant medications that people with ADHD are often prescribed, which increases the availability of that dopamine and norepinephrine in that prefrontal cortex. Exercise leads to immediate improvements in ADHD symptoms and cognitive function. So on testing, for those who do testing, this looks like improved response inhibition, impulsivity, attention, task switching, and cognitive flexibility. And in real life, this looks like improved attention, time management, planning, organization, multitasking, and recall. We can also see improvements in reading comprehension and arithmetic shortly after exercise for individuals with ADHD as well as those without ADHD. Exercise has a number of benefits for individuals with Parkinson's disease, so it can help improve gait and balance, flexibility, posture, endurance, sleep, and cognition, so things like attention, concentration, and decision making. And it also decreases falls and improves mood. And there are a number of exercises that have been recommended for individuals with Parkinson's disease, such as non-contact boxing. So there is a such thing as Rock Steady Boxing, which is a program that involves non-contact boxing for people with Parkinson's disease and movement disorders. I've also seen classes, not specifically Rock Steady Boxing, but other non-contact boxing classes offered at my local YMCA. So that's another resource to check out. Tango classes are a fun way to help with motor symptoms, balance, and walking speed. HIIT, high intensity interval training, helps with aerobic exercise and strength, and it can improve fitness. Walking assists with gait, and then walking with music has additional benefits because it helps with coordination. So you can help individuals walk to the beat and kind of keep up with that beat, and it helps with their coordination. Now, there is a lot of research looking at exercise and dementia risk. So active adults experience fewer changes in biomarkers associated with Alzheimer's disease, such as lowering the increase of white matter disease in the brain. Lifelong physical exercise has a strong association with decreasing the risk for cognitive decline and delaying the onset of decline, so delaying it until later on in life. Higher levels of baseline fitness tend to decrease the risk of dementia. So there was a study that stretched over 44 years. Now this is big because we don't get many long-term studies like this, but this one looked at individuals over a span of 44 years. And they found that for those individuals who had high fitness, there was only 5% of them went on to develop dementia, whereas individuals in the low fitness group, 32% of them went on to develop dementia. In mild cognitive impairment, we can see improvements in global cognition with aerobic exercise having a higher effect. And so I do want to talk just a little bit about the genetic risk. So I often get patients coming in asking about this particular gene. It's called the APO or apolipoprotein E, and it's the most common gene linked with late onset Alzheimer's disease. It does have three common forms, so E2, E3, and E4. And E4 is what we know increases the risk for Alzheimer's disease. So overall, I will say that the relationship between exercise and ApoE4 is not fully clear. But in studies that have looked at it with ApoE4 carriers, they found that midlife physical activity decreased the risk for all types of dementias over 2 decades, particularly in ApoE4 carriers. But exercise in late life, physical activity in late life, did not have those same protective factors. So it did show short-term benefits for non-carriers of ApoE4, but not in carriers. So again, overall, the impact of activity on Alzheimer's disease and ApoE4 carriers seems weaker at older ages. But again, the research is not fully clear. So at this point, we know that exercise has many benefits for the brain, mood, and physical health, but are we actually doing it? So I'm going to present a couple of statistics in the US. So this first one shows that the percentage of adults age 18 and over who met the 2018 physical activity guidelines for Americans for aerobic and muscle strengthening activities. And so we're looking at sex and age here. So we can see that men overall engage in more physical activity than women. And the age group of men that engage in the most physical activity is the age group of 18 to 34, with the other groups not engaging in as much and overall kind of seeming to decrease with age. But even still in that age group of 18 to 34, only 41% of men in that age group are actually meeting the recommendations for physical activity. And then we see the same kind of pattern in women where that same age group of 18 to 34 is the most active and it seems to decrease with age. And again, the number of women actually engaging in physical activity is less than half. So we're at 20, looks like 28-ish% here. When we break it down by race, we can see that in men, we have the non-Hispanic white group, non-Hispanic Black group, and non-Hispanic Asian group are the most active, with the Hispanic group having lower physical activity. And then in women, we see that non-Hispanic white tends to be the most active, and then activity is lower in the Black populations, Hispanic and Asian population. And so those numbers are all hovering around 18% or so. And so now let's take a look at physical activity by income. So we can actually see that those with higher income tend to be more physically active. So this has implications for access and the potential financial burden associated with paying for things like gym memberships, equipment, club memberships for kids, uniforms, and whatnot. So there are some barriers to access to exercise. So one of those being access. So do we have access to facilities and activities? So let's think about the fact that African Americans tend to have lower access based on demographic factors and where we're living and socioeconomic status. So lower access to certain places and activities like parks, bike lanes. People in rural areas may not have safe sidewalks to walk on and get exercise outside their home, playgrounds, local clubs and teams, a variety of sports in schools. When I was in middle school, the only sports that we had were volleyball, and we had a concrete track, and that was it. So the variety and options in schools is really important. And then paying for organized sports may be cost prohibitive as we just discussed. Physical mobility is really important to consider and can be a barrier for people. So if we're considering disability, people who may be in a wheelchair or weak, people who may be in chronic pain or have certain injuries, we have to walk the line between promoting physical exercise, which I still think is very important for these groups, and also considering what is safe for them to do. So we want to make sure that we are encouraging safe physical activities. And so this is something that I talk with my patients very often about is, well, they'll say, I'm in so much pain, I can't work out, or I have this injury, I can't work out. And so I say, well, let's think about what we can do. So what are some safe activities that we can do? If you sit in the chair and you just do body weight arm lifts, or you grab some 1 pound weights and you do that, we're exercising, we're doing some physical activity, and that's great. If you're stretching, we're moving your body, we're increasing that flexibility. That's great. I very often recommend water aerobics to people who have pain or certain limitations because it's safer and it's less painful on the joints, and it can actually help to improve some of that pain. So that is an activity that can be really beneficial. So we just want to think about what are things that are safe to do to minimize falls and injuries, and these activities, engaging in activity when you have pain or an injury, can actually help improve some of that pain and improve the recovery. So we still want to promote exercise for those people, but just think about what's going to be safe for them to do. Time is a big one that I hear. Well, I don't have time, especially in the sandwich generation, right? So people who are kind of in the middle as far as age, they have kids, they have parents who they may be caring for, they have a full-time job, they're trying to maintain their social life, they're trying to get good sleep. So there's so many factors that can suck our time. And so I encourage people to always think about what are some ways that we can find little bits of time to still engage in exercise, even if it's not that 1 hour that you're able to set aside. Are we able to wake up 10 minutes earlier to do some kind of physical activity before you start your day? Are you able to walk a little bit on your lunch break? Are you able to not be on social media for 10 minutes so that we can get some exercise in there? Are we able to have a standing desk at work? And you can get some of those for fairly inexpensive. So if you're sitting at work a lot, get a standing desk so that way you can stretch and kind of stand and move your body while you're working still. And then I've seen a lot of desk treadmills that have become very popular these days. I see people at the gym all the time, and they have work that they're doing on their phone. So there are ways that we can find the time to do it, and we just have to make that commitment to do so, which can be hard. It can definitely be hard. And so motivation is another factor of, I just don't want to. And that is a perfectly normal response that I hear from people is, I don't want to be active. I've never been the type to work out and I don't want to. But I hope that in hearing this talk, people will kind of be receptive to the importance of exercise in maintaining overall health. And maybe that can be a little bit motivating. Now, one of the things that oftentimes comes up when I am talking to patients and their families is their family members may be very frustrated because they're saying, well, my husband just doesn't want to work out. Mom doesn't want to work out. They get mad at me when I suggest it. And so we do have to find that motivation somewhere. And so I do encourage people to, let's just start really small. Let's start with 2 minutes a day and see if we can build from there. And then maybe we can help to stimulate that motivation to do more. Comparison can also be a barrier to exercise and can make people kind of retreat and say, well, I don't want to. And so people may compare themselves to other people. So they may say, oh, well, my friend is able to run 5 miles and I can't even run one. So now I feel discouraged and I'm not going to exercise. Or they may compare themselves to their old self, like, before pregnancy, I was able to run 3 miles, and now I can't even run half a mile without being out of breath. But it's important to remember that comparison is the thief of joy. And so we don't want to continue to compare ourselves to other people. We want to fill our minds with motivating, positive thoughts. And if you're using comparison as motivation, then that can be okay. But when we start to compare to other people or our previous selves and it becomes defeating, then we need to make sure that we are removing those kind of thoughts and focusing on how can we get to the place where we want to be. Another thing that may be a barrier is knowledge of what to do. So especially if you've never been someone to exercise, you don't even know where to start, what to do, that can be a barrier. Or for people like me who I go to the gym, and if I go without a very specific plan of what I'm going to do, I just get overwhelmed and I might leave. Whereas other people can just go and they just jump right into a workout. So knowing what to do can also be a barrier. And then perception of safety, which I'm going to touch on a bit more. So there have been some studies to look at perception of safety, and I do want to highlight this one. So there's studies to suggest that Black men are less likely to be physically active in neighborhoods perceived as predominantly white, and more likely to be active in neighborhoods that are perceived as predominantly Black or mixed. In contrast, Black women are less likely to feel or to be physically active in neighborhoods perceived as predominantly Black, and are more likely to be active in neighborhoods perceived as predominantly white. So we want to think about this perception of safety and what we can do about that, especially as it relates to where we live, where we work, and our access to facilities. As I showed on a chart earlier, African American women have the lowest percentage of any population group in meeting national recommended activity guidelines. So we want to know what we can do to change that. So what can we do? We want to consider values that motivate people. So accessibility, making sure that there is access. So if there's nothing nearby, do I have access to a space within my home or my yard, or right outside of my home where I'm able, just a small space where I'm able to do something? Do I have access to public transportation that can get me somewhere, or ride share services that can get me somewhere, or a neighbor who we can go together and get somewhere? So really important to think about that accessibility. Next, the perception of non-discrimination. So no one wants to go and be in a place where we feel like we're being discriminated against. And so that is really important to highlight and to seek out places where we feel comfortable in. A sense of community and belonging. So if you were in the amazing talk that Dr. Pugh gave yesterday, where she talked about the community and being around people and the benefits of social connectedness, that's really important. So grab your best friend, grab your neighbor, go to the gym together, get a group together. There are plenty of running groups that meet together, and it is truly like a family. When they get together, they host events outside of working out. You can become a really good close member in your local gym. So there's all kinds of groups that you can join to feel connected to, and then that'll increase the likelihood that you actually continue to go and be active. And the perception of safety we just discussed, and environmental norms. So we want to seek out and create environments where physical activity is the norm. And that way other people are encouraging you. You feel motivated to go because everybody is doing it. It is the norm. Whereas in contrast, if you're in an environment where the norm is to not do any kind of physical activity, and when you say you're going to work out, someone says, well, why are you going to do that? You don't want to be in that kind of environment, because that's not going to be beneficial for you. So literature is vast, and there is not solid evidence of the type of exercise that is recommended, but I'm going to present some key takeaways from the literature. So overall, aerobic exercise appears to have better impacts on cognition than stretching. Walking is exercise, so very important. Don't think that your steps don't matter. Just under 10,000 steps per day, which is about 5 miles, is associated with a lower dementia risk. And higher intensity is more strongly connected with a decreased risk. So if you're walking faster, you're getting our heart rate up more, that is going to be more closely associated with that decreased risk of dementia. Resistance training has resulted in meaningful improvement in cognition in older adults, and a multifaceted approach that involves physical, cognitive, and social engagement may provide more value. So let's think about a dance class like Zumba. You go there with your friends or you meet people while you're there. You're trying to learn the steps, so that's that cognitive engagement. You're working up a sweat as you're doing the steps, so that's that physical engagement. And then you're around other people in the class. You all are laughing at yourselves, you're laughing at each other as you kind of fumble through some of the steps, and that's that social engagement. So it hits on all those different factors. And so we do want to try to get activities where you can kill all three birds with one stone. And then next, we have the physical activity guidelines for Americans. So here are the guidelines for the frequency of exercise. So for children ages 3 to 5, 3 hours per day of active play is recommended. So let's get out there with them. Let's get them to the park, outside, running, doing all of those things, because 3 hours is a lot, and we want to make sure that they're getting it for their development. For youth ages 6 to 17, at least 60 minutes per day of moderate to vigorous activity, as well as muscle strengthening activity, is recommended. So this could be defined as anything that makes the heart beat faster, like running or walking, and then activities like climbing at the playground, basketball, jumping rope, those all help to increase muscle strength. Now, one thing that's important to note is that many schools have over the years scaled back on requirements for daily recess and don't prioritize physical education opportunities for children at every age. So we do want to think about, one, how can we advocate for more physical activity in our schools? Two, how can we advocate for more access to activities in our communities? And three, what ways can we maintain the activity of our kids or promote that activity, get them involved after school, outside of school? So whether that's a sports club, whether you're going on walks with them, whatever it is, to make sure that they're getting that activity. For adults, the recommendation is 150 to 300 minutes per week. So that breaks down to 30 to 60 minutes per day for 5 days per week of moderate intensity aerobic exercise, as well as muscle strengthening, or 75 to 150 minutes per week. So again, if we're going with the 5 days a week, then we want you to do 15 to 30 minutes per day for those 5 days per week of vigorous exercise. Very important to remember that recommendations differ by person. Everybody is different. For example, obesity was found to be a main moderator of the effects on cognition, in that overweight older adults may benefit from a lower exercise level than what is recommended. So it's really important to think about what's best for you and not get discouraged through that comparison thing again, right? So if you go from 0 minutes of working out, you don't want to say, well, okay, now I'm going to go straight to that 300 minutes, because you may benefit from lower levels if you've been less active to begin with. So we want to think about how can we work ourselves up so that way we don't get discouraged. So how do you know if you're doing enough? Some physical activity is better than none. I always say this to people. I want you to do something. I don't care what you're doing. I want you to improve your physical activity some kind of way. So when we talk about moderate intensity exercise, That means that on a 10-point scale where 0 is sitting and 10 is working as hard as you can, you're somewhere in the middle, like a 5 or 6. So you're breathing harder, your heart rate's up, but you're able to talk, but not necessarily able to sing your favorite song. Whereas vigorous activity is on a 10-point scale, it's about a 7 or 8. So you're not able to say more than a few words without having to stop and catch your breath. Now, some people ask if they go above and beyond the recommendations for exercise, will they see even more benefits? And the answer to that is likely not. So once we get above a certain threshold, that 300 minutes of moderate activity or 150 minutes per week of vigorous activity, the benefits become less clear. And there's an overall inverted U relationship. So the middle tends to have the best impacts on cognition, whereas too much or too little may not have as good benefits. So some tips for increasing physical activity are to set realistic expectations. And I talked about this a little bit, but making sure that if we have been sedentary and not doing any kind of exercise, that we don't say, okay, next week I'm going to run a marathon. We want to make sure that we set ourselves up for success by making small, measurable goals. And yes, those small, measurable goals can lead to the bigger goal of running a marathon, but we want to make sure that we start somewhere. And so I often recommend, let's start with 5 minutes for 2 days a week. And then after you're able to do 5 minutes and you feel comfortable with that, let's bump it up to 10 minutes, 2 days a week. And then let's bump it up to 20, and then let's increase to 4 days a week. And so we just continue to bump it up as you feel more and more comfortable and get more and more confident in yourself. And then we can, work our way up to those larger goals. Another important thing is to create a regular schedule. So I encourage you to put a big calendar, dry erase board in your living room, in your bathroom, on the kitchen refrigerator. And then make sure that you're writing the activity that you're going to do. So let's say you see a class at your local community center and it's aerobic or it's water aerobics, and it happens every Tuesday and Thursday at 11 o'clock. Go home and write on your calendar every Tuesday and Thursday, I'm going to water aerobics at 11 o'clock. And do that, and that helps to hold you accountable. It's planned, it becomes a regular routine, you come to expect it, you're not caught off guard, you know it's coming up, and you've planned to do it. So that actually really does help with increasing the likelihood that you'll go. Recruit an accountability partner. So again, bump up that social engagement and bring somebody else in with you and go together. Pay for a gym membership or a trainer. Nobody likes to lose money. So if we pay for something, we're more likely to actually use it. And then find activities that are enjoyable. I cannot stress this enough. This is extremely important for increasing the likelihood that you are going to continue going. So I bring this slide back just to highlight that there are so many types of activities that you can do. Try one of them, try them all, find the ones that you gravitate towards and keep doing that. And then here's a slide, it's just a screenshot of some activities that I pulled from my local YMCA that has a description of the classes that they offer. And it also breaks it down so you can see what types of classes are low intensity and what types of classes are mid to high intensity. So all that to say that it is really important to find something that you enjoy in order to increase the likelihood that you will continue doing it. If you're dragged to something by your husband, your cousin, your brother, whoever, if they try to make you do something that you have no interest in, you're likely not going to want to go back. But if we get you in some activities that you do like, then it increases the probability. And so here are some specific tips for children. So it's really important to remember that kids want to be just like their mommy, their daddy, their brother, their cousin. they want to do what you're doing. So if they see you exercising, they are more likely to also just jump in there with you and want to be active themselves. Make time to play and be active with kids. So get in there with them. And so, that helps with their physical activity, but it also helps with yours if you're in there doing it with them. Give them gifts that involve games and sporting equipments, and this can help to encourage them to get involved in those types of activities. Make a routine of daily walks. So let's say after dinner, before you get ready for your bedtime routine, you all take a family walk. Send them on scavenger hunts throughout the yard or throughout the house, and they're running around finding things. Have a dance party and involve them in gardening and yard work and other household chores, and help promote activity that way. And as a reminder, physical activity is not the only important factor in maintaining brain health and maintaining your overall health. So I do want to bring back in the things that we've talked about at Brain Awareness Week this week, which were stress, sleep, social engagement, and today physical exercise. These are all really important factors, as well as nutrition, cognitive engagement, and medication compliance. So these are all really important for your brain health and your overall health. And here's just some resources. So I encourage you to look into your local YMCA and other community center websites to find activities. The YMCA does offer online options for activities. So if for some reason you can't leave the house, maybe you don't have access to transportation, it's too far, there are online resources that you can do on demand. YouTube has plenty of resources. You can search basically anything you can think of on YouTube. Here's a couple of channels that have some good videos, but there are many, many, many more. So I put on here Pop Sugar Fitness, Nourish, Move, Love, and Mad Fit. There's another resource called Couch to 5K, which is basically exactly as it sounds. It gets you from basically not doing much exercise at all to being able to run a 5K. There are plenty of apps that you can use and that I love. So Nike Training Club, 7-minute workout, going back to the barrier of I don't have time. Let's see if we can fit 7 minutes into your day to do a quick workout using this app. Apple Fitness, I absolutely love. It has plenty of different types of exercises on there. They guide you, they motivate you, they cheer for you. Same thing with Ladder. It's like having a personal coach in the palm of your hand, and they cheer for you and encourage you. And there's a community aspect to that too, with chatting with other people who are doing the same exercises as you. And then ClassPass can help to get you exposure to a number of different types of activities. And the last one here is presented by the U.S. Department of Health and Human Services. That website is health.gov/moveyourway, and it has a lot of different resources on there as far as how to get more active. And finally, I just want to thank everyone who has attended today for coming to this final talk of Brain Awareness Week presented by the Society for Black Neuropsychology. It has been a pleasure to talk about this topic today, and I welcome any questions.
Thank you so much, Dr. Walker, for that wonderful talk on physical exercise. I'll go ahead and kick things off with a couple questions, kind of regarding around motivation and specifically strategies or things people can do to help motivate the loved ones in their lives, and how they can, get them to, implement and be more, active and doing exercise and things like that, what they can specifically do to help motivate them.
Yeah, so motivation is one of the toughest things because it's such an intrinsic factor, and that if that person is not internally motivated, it's really hard to get them to be motivated. So, I mean, I think things like, educating them about the benefits and kind of targeting what is behind that lack of motivation. Is there something underlying other than I just don't want to? Is it actually I'm afraid that other people are going to see me and make fun of me? Is it that I'm afraid that I won't be able to do as much as I want to do? Kind of really talking with that person and getting a better understanding of what is driving that lack of motivation. And it could purely be, I simply do not like exercise and I don't want to. And so we then want to still be creative in finding activities that they might be motivated to do, even if that's not hiking, jumping, running. I always tell patients, I'm not telling you that you have to go run a marathon or that you have to climb Mount Everest. I want you to find what you enjoy doing, and that way you can do it. So really, again, thinking about let's be creative with some of the different types of activities to just get your body moving some kind of way. Even if we're not going out to the gym, we don't even have to leave the house, but let's think about different activities, and I'm going to do it with you. So instead of just telling you, hey, you need to work out, I'm going to do it with you. Here, I'm dressed in my workout clothes, I'm ready to go. Let's do this. So really just being really creative and persistent, but not too pushy, right? Because we don't want to ruin the relationship with that person either, of being too pushy and then they're frustrated with us and everybody's upset. So there's a fine line to walk, and I don't think that there's any perfect solution, but we keep trying to be creative and keep being encouraging and motivating in that way.
Excellent. Thank you. And I do just want to note we have a couple comments about folks appreciating the recommendations that you've given and that you had a wonderful presentation. Some other questions I think that folks who are maybe wanting to get back into physical exercise is how to maintain the motivation for themselves as well. So you talked about, setting very small, achievable goals and setting realistic expectations. Do you have any suggestions for folks who, start out really strong and then kind of as they're, getting back into things can kind of fall off again?
Yeah, I mean, that happens to the best of us. It has happened to me countless times. And so I think just really having compassion for yourself, because as humans, we tend to beat ourselves up and we tend to say, oh, darn, I was doing this and now I can't get back to that same level. And now I'm really down on myself about that. So to have some compassion for yourself about the fact that we're not always going to be at the top of our game, and that's okay. But yes, if that is truly your goal and you want to get back there, then let's get back there and just continue to start small and to build your way up. But I think that compassion for yourself goes a long way, and can drive a lot of that lack of motivation when we tend to beat ourselves up.
Absolutely. And thank you for that. Additional questions, just kind of around for folks who are maybe wanting to get more involved in their communities, and how they can relay some of the information that you've provided today to other folks in their lives. What key takeaways or things would you suggest that people are utilizing whenever they're talking about people about exercise and brain health and the benefits of that?
Yeah, so I mean, there's a lot of information on websites like CDC, the World Health Organization. When we think about specific, like the AAA, the areas for aging agencies in aging, or just those A's. I can't remember the exact order, but when we go to those types of websites, so AAA at like your local one, and then WHO, CDC, like specific areas like the Alzheimer's Foundation, Parkinson's Foundation. So they have a lot of resources specific to different ages and different disorders. And so we can look at those resources. They have plenty of pamphlets that you can print out. You can also grab pamphlets from your local community centers and YMCAs that just talk about the benefits. Your doctor's office, I've seen plenty of pamphlets in my doctor's office about smoking, sleep, exercise. So there's lots of information out there that we can get. and then be able to share that with other people in our lives.
Thank you. And it looks like we've got a question here. What are some of the ways that can make you feel safer when you're working out?
Yeah, so I guess I want to know a little bit more about the question as far as physical safety or, like physical safety is really important. So I want to kind of think about this from two lenses. So one, um, safety as far as risk of falls and injuries. So we want to be aware of what our physical limitations are and talk with our doctors before we start any new exercise routine if we are concerned about that and see what they would recommend. So obviously, if we're having balance issues, it may not be the best idea to go on a balance beam, like some kind of gymnastics like that. Like we don't want to do that. So if you're having balance gait issues, it may be better to do something like chair exercises, or even, I talked about in Parkinson's disease, things like the non-contact boxing and the walking with music. Those things can really help with the gait and the walking and the coordination. So we want to think about those types of things that are going to be safe. Our doctor recommendations, if you've done physical therapy, or even ask your doctor if you might benefit from physical therapy, and they can help you um, do exercises that are going to help you stay safe. And then also considering having a trainer, someone there to support you to make sure that you are doing activities that are going to be best for your specific situation and aren't going to put you at an increased risk. So all of those things, I think are important for that aspect of safety. And then the other aspect of safety, which I touched on before in the talk, thinking about your environment and those findings that Black men tend to feel less safe in predominantly white neighborhoods, and Black women tend to feel less safe in predominantly Black neighborhoods. We want to think about, the real threat there. Think about Ahmaud Arbery, who was shot in that neighborhood. So, I mean, I think that those are real concerns, and we need to consider, if I don't feel safe in this space, can I bring someone else or run in a group, do some kind of group activity where that would increase the safety of the situation, or seek out those environments where there are more people who look like you, to make you feel safer in that way.
So, thank you. All right, it looks like we have time for one more question. Uh, in terms of kind of going back to safety and making sure that you're feeling safe and having others potentially like around you and bringing folks with you to kind of create like a safer space. Uh, what are some alternative things that other people can do? So, for example, are there alternative environments that people can go into or alternative spaces that might be better for folks? Just what are some of the ways people can go about creating a safer environment in addition to potentially bringing other folks with them?
Yeah, so this goes back to access, transportation, financial situation. So if there is access to nearby facilities, that would be beneficial. So people tend to feel safer in more of an organized type of environment. So in a gym like a Planet Fitness, or 24-hour fitness, LA Fitness, things like that. Or in their community center with other people from the neighborhood who they know and feel comfortable with. So if those things are close to you and you have access to them and transportation to them, I would definitely go that route. If not, then if we don't have access to certain places or transportation, then and we don't feel comfortable outside of our home, then yes, you can still do home exercises. And, I presented some information about some virtual things like virtual YMCA classes, YouTube, apps. And so, that's a little bit harder because I do want people to get out of the house and be active. But if we can't do that, then certainly being in the home and doing activity on your own or whoever else is in the home with you can be beneficial, especially if you can create a specific area in the house where this is my workout area, and it helps to motivate you in that way.
Thank you again so much, Dr. Walker, for your talk and for answering these great questions and for folks joining us today. This is a wrap on our lecture series for lifestyle factors in brain health. I want to thank you all for joining us tonight and hope that you guys have a wonderful evening.